And good evening or good morning or good afternoon, wherever in the world you are. I am Debra Morrison, your host of this Thursday interview series with such an esteemed guest tonight, my personal breast surgeon, Dr. Elissa Santoro. Doctor, welcome to the show.
Thank you so much. It's such a privilege to be able to reach so many people with good news.
Isn't this the truth? Now, I want to say this doctor is exemplary in so many categories. And yet I'll share with you. It was over 30 years ago. I was sitting in the hospital holding the hand of my dear friend who had just had a double mastectomy at Dr. Santoro's suggestion, and she was the surgeon. And I simply visiting her. And as it was to be, Dr. Santoro walked through the door and she came on the other side of the bed. And she held my friend's hand and she held my hand. And she leaned down and said, "I'm sorry. The cancer is in your lymph nodes." And we wept together, a little triad in a hospital bed. We wept together with our doctor, with her doctor. Now, when does that happen? Not so often, you see, not so often. And I said right then and there, if I ever need a breast surgeon, there's one woman I'm going to, and that's Dr. Elissa Santoro. Well, fast forward. I am lying. Doctor doesn't even, I don't even think she knows this. I went to her with a breast lump. She said, "I have a surgery date for March 26th. I was like frozen. I was like thinking in my head, okay, the sooner the better. That's my birthday. I lay on the operating table on my birthday, my 40th birthday. And the biggest present I got in my entire life on my birthday was Dr. Santoro saying, benign. And I also remember in her office, she said to me, if you don't want to see me again, cut back on the stress. And I did. And thankfully, I see her now at the Montclair Breast Center in Montclair, New Jersey, as just a follow-up. She has joined this practice. And when they invited her in to join, I was just like a cheerleader jumping up and down. I was so excited. So that's my personal story with Dr. Elissa Santoro. And here's some of the background. 50 plus years of medical experience as an oncologist. And she's loyal to her patients, as you just heard, proven in commitment. This woman has been working since 8:30 this morning. Yes, she has. And she is still working and talking with us because she cares. She's done a huge stint, almost 50 years at the St. Barnabas Medical Center, where I was operated on, was the first woman surgeon at St. Vincent's Hospital, and has been instrumental in changing the medical arena. And she has an unparalleled commitment, as I say. She was awarded in 2018 the New Jersey Top Doc, a patient preferred physician. That's always a beautiful vote. And the first individual to receive the Outstanding Woman in the Field of Medicine, now named the Christine Dodd Whitman Award. She was, of course, our former governor. She's partnered with the New Jersey state legislators. Here it is, legislation assisting in the development of the Women's Health Department. Don't we need more research on women to increase fund allocation to breast cancer research? And she's committed to offering the best level of care. And what she has done for women is unmatched. And so I ask you, Doctor, what in fact has been, outline some of the differences in the breast health 54 years ago versus today.
When I started, no one knew what a breast cancer surgeon was. The concept was that the family doctor of those days was doing the surgery. Some gynecologists were doing the surgery. And I had 2 fellowships, the American Cancer Society Cancer Training Fellowship, and I did that at St. Vincent's. And then I went to New York Medical, where I was awarded the National Institute of Health Cancer Training Grant. And at that time, chemotherapy, there were no medical oncologists. There were hematologists, but no medical oncologist. So I was part of the central oncology group in my fellowship, and we were studying whether or not to give, we only had 5 drugs, chemotherapy after surgery, called adjuvant, or wait till they get metastases, which was common, because you have to remember there was no mammogram.
Yeah. Oh,
Everybody came with a lump. Almost everybody. So I was very well versed in the clinical trial.
yes.
Now, this is important. It's called a trial, which I beg all the women who ever have a diagnosis of breast cancer to be enrolled in a clinical trial, because the more people that do it, the more lives we save. And the patient is not getting a placebo. That's a misunderstanding. They're getting standard care versus something new. So clinical trials are saving lives, and we're learning so much. Now, 1974, if we all, those who are not around at that time, but those of us that were, in 1974, Betty Ford
Yes, of course.
had breast cancer, but she had 3 things. She had breast cancer, and she also was alcoholic,
Yes.
and she's also addicted to prescription drugs. That was that era. Now, the family, the Ford family, the president and his family had to do an intervention. She talked about her breast cancer. She talked about her prescription drug addiction, but she wouldn't talk.
She wouldn't talk about the alcoholism.
She would not talk about the alcoholism.
Mhm.
And so they had an intervention. Now, many of us older folk remember she started the Betty Ford Foundation,
She did.
and that's where Elizabeth Taylor mostly lived.
Yes.
But by her example to the world, it was to the world, the president's wife, we knew that if we gave chemotherapy after surgery, that was what we were seeing in the research, clinical trial, we could change the outcome, not wait till it's
Yes.
spread.
Yeah.
So we had to give it to all women because you cannot discriminate. And I credit Betty Ford of saving more lives than anybody. It's not understood that way, but I understood it, because now mammograms did not exist until they were rudimentary.
Yes.
And in 74, they were done by Xerox. It was like a zero mammogram. And she pushed for mammograms. Not only that, the world now knew about adjuvant chemotherapy, which we would have probably had to wait 2 more years.
Hmm.
Then look at all the lives that got saved.
Yes.
And now it's the standard of care that people in general, if they need therapy, will get something to prevent recurrence. But Betty Ford Foundation was critical. Now, another factor came up, it was never discussed. Alcohol, more than 1 drink a day, has been shown to increase the risk of breast cancer.
Yeah.
Now, this was so profound.
Yes.
And we beg our patients not to drink if they are more than 1 glass, and not a water glass.
Right.
But a little old wine glass. People don't know what I'm talking about, because in my day there was a wine glass, not a water glass.
Exactly.
And but see, 3 things happened. We opened up the adjuvant chemotherapy, saved lives. We opened up alcoholism as an increase for breast cancer.
Yes.
We got rid of the myth that if it's not in my family,
That's right.
90% of the people get breast cancer, including men.
Yes.
and they have a gene usually, but not necessarily.
Mm.
So about 2% of men get breast cancer. So they think when they have what they call gynecomastia, some men have hormones that make their breast, it's like a gynecomastia is the big word. And
Okay.
teenage boys may start to develop it and they can't wear t-shirts, go to the beach without a top. So it's a very emotional issue for a man. And most men deny they have a lump because that's only for women.
That's right.
So wives, women that love men,
Mhm.
make sure that if they say they have a lump, that they get checked out. Now, most are not going to be positive, but 2% of men will be positive.
Exactly.
And they also may carry a gene, BRCA1 or BRCA2, usually BRCA2.
Back to, yeah. Mhm.
So with Betty Ford opening up chemotherapy, even though it was rudimentary, she opened up reconstruction that was rudimentary,
Right.
but started. She made women whole again psychologically because many women went flat.
Yes, exactly.
And so this is a wonderful, I just look at her and say, thank you, God, that she was the president's wife
Absolutely.
and that it brought out the role of alcohol. Now, she had another factor not discussed. She did not want to be a president's wife, meaning she was unhappy to be put as a first lady. Now, what does distress do to your body? Because we're human beings, mind, body, spirit. Distress raises adrenaline, cortisol. It affects our whole being. Our immune system goes down.
Right.
People can't sleep. Sleep deprivation is not discussed enough. You can't sleep 5 hours. You need at least 7, but not just in bed. You have to have a deep and restorative sleep.
Mhm.
And there's a lot on that coming out now in research showing how important it is for the immune system.
Yes.
So I'm using her as an example of the multifactorial reasons that can't say, contribute, but she had no family history. Alcohol, we now know, because why? The liver has to break down alcohol.
Thank you.
Estrogen has to be broken down in the liver. Now, when you overdo alcohol, just 2 glasses a day, you slow down the liver function and the estrogen goes up.
Wow.
Now, if estrogen goes up, the targets would be ovary and breast. So this is why the studies came out. Women should not drink more than 1 glass a day. Men are always different. We're all different.
Yes.
Men, they're built differently and they don't have the estrogen a woman has, so they can have 2 glasses.
Okay. Okay.
But it's because of the biology of the hormone difference. Men have estrogen, but not at the rate as a woman.
Exactly. Okay.
Now, another factor that is of interest, what's happening right now in our society, and I'm an educated woman.
Yes, you are.
So women are having their babies. If you have your baby age 30 or later, and what happens is we're delaying our pregnancies because of multiple factors, not
Sure.
just education, but who can't afford it, you know. But when I finished high school in 1956, I think about 3/4 of my classmates that were women had babies. They got married after high school. They had a lower risk of cancer. I mean, considering other factors, but where are we now? Most women are having their babies 30 and up.
Yes.
And now the fertility rate has gone down because as we mature, both men and women, the sperm counts have been going down for the men. For the women, the ovulation, the hormones are going down.
Yes.
So this affects the breast.
Yes.
Now, I remember, fortunately, I'm Italian, and breastfeeding
Yes.
in our culture, you're not a good mother unless you breastfeed. And that was a hard thing on women that couldn't breastfeed.
Yes.
Yeah, but they came out, doctors or scientists or pharmaceutical companies said, we can make better milk for women, better milk than women can.
Yes.
So don't breastfeed. All right, what happened? The baby did not get the immune system of the mother. And this is another, we had this, I think I'm going to be 86 because I was born at the right time. My mother breastfed all three of us, and we're all well. And my brother's a doctor, and he just retired as a radiation oncologist.
Wow.
So my other brother was in law. So, but we were breastfed. And that was considered, of course.
Yes.
Now, when you breastfeed, the baby usually likes to go to the side, the left side, where the heartbeat is the loudest. Because when the baby was in utero, that's why the baby knows its mother, by the heartbeat. So the baby is healthier, immune-wise, nutrition that can never be imitated. God made women to have breast milk to procreate the race.
Yes.
And immunity for disease.
Right.
And then the woman gets a hormone called oxytocin.
Yes, of course.
And that happy hormone, we know from other factors.
Yes.
The pleasure hormone.
Yes.
And that pleasure hormone, I believe, was placed by the Almighty so that the woman would want to breastfeed, because breastfeeding makes the woman feel better. There's always exceptions, but I'm just saying, usually the oxytocin makes the mother want to breastfeed. And then when they came along with the pharmaceutical companies, oh, we can do better.
The formulas, yeah.
Yeah, the formula. Now, of course, some women have to have that, but I'm just talking about when it's possible, it's preferable, and breastfeeding lowers the risk of breast cancer.
Wow. Now
See,
let me circle back.
the lobules in the breast make the milk.
Good. Yeah,
There's a lot of lobular cancer, which is very hard to pick up because it blends so much on the mammogram, even on the MRI. So, and it can't be felt right away because it's like layers. Now, being Italian, I'll say lasagna, layers like that. And the ducts are the delivery tubes. So breast cancer can be picked up in the ducts much easier than in the lobules because they're flat. So it's a reason that it seems that the breastfeeding has so many benefits to the mother, to the baby. And this has been not emphasized enough.
Right.
And I wanted to bring that up. So any woman having her first baby at 30 and on, and we're having it at 35, they're having it at 39, they're having it at 40. And then the infertility rate goes up. So now we're trying to do, IVF, egg transplant, all this stress on the partner as well as the woman.
Exactly.
And this has led to a lot of dysfunction in the marriage.
Yes.
And it's very, very hard. Also, I just remember my mother had me when she was 23, which was common.
Yes.
I think she was even old because
Yeah.
a lot were having them at 18, but my mother got it at 20. I was in the depression baby, they call it.
Okay.
So they weren't really quite ready, but I decided to come uh, on St. Luke because I
Yeah.
had to be a doctor. So, but you see, she was able to run after me. She was young. She
Yes.
had the energy. She could lose sleep.
Yes.
Now, women are professional, high number. They're stressed at work. They're stressed trying to take care of children, caregivers, guilt,
Yes.
the whole package. Is bad for your immune system because we're mind, body, spirit. And we have to attend to all three.
Mm.
And it's so important. And the feedback a mother gets from her child when you're young, and you can embrace them and run after them and keep up with them.
Right.
But, as we get older, how many grandparents say, I can't keep up?
Yes. Mhm. Mhm.
And they say, I like being a grandparent because I can go home at night and sleep.
Exactly.
That's another one.
Well, this brings us to this whole element, doctor, of exercise being
Oh, yes.
great.
Exercise is important for the
Let's
whole
talk about
body.
it. Yeah, let's
Now,
talk.
don't forget, women have hearts.
Yes.
So heart disease is not a man's disease,
Uh-huh.
but we get different symptoms when we have heart. Everybody before it was knowledgeable, women used to die in the emergency room in the gastrointestinal section because they would be feeling like nausea,
Yes.
and they have a different pain
Mhm.
than the men.
Mhm.
And so as a result, it took years before the cardiologist finally realized, don't take the woman with chest pain and think she has indigestion.
There you go. There you go.
And that's been another breakthrough. Now, diet, I'm going to run into diet.
Let's do it.
I grew up in a victory garden, World War II. Being, again, Italian, my grandfather had an acre that he planted.
Yes.
And we all ate out of victory gardens in our backyards, our side yards, everything. And our soil was rich in minerals, no Roundup.
Yes.
And it went directly from the garden to the kitchen.
Absolutely.
Now, our little chickens that
Yeah.
we had to go to the chicken store where the chickens were running around and they were being fed correctly, no chemicals,
Yes.
no antibiotics, no steroids. And then we point out to the chicken, and that poor little chicken came home with us without its little head.
Yeah.
And then we plucked the feathers and singed it, we used to say, on the gas range
Yeah.
for, sterility, so to speak.
Yeah.
And our chicken walked through the water that was the soup, and then it became cacciatore, the same little chicken.
Exactly.
Now I look at chickens that they're antibiotic fed because they're squashed together.
Yeah.
They get steroids to make them fatter,
Yeah.
and they're being fed foods that are not natural to make them heavier. So you really have to buy organic or free range certified. Now that's the key word. Don't look on the package. For instance, if you get something out of season from Mexico,
Yes.
it's organic, but when it gets to the United States, they have to spray it. So people think, oh, it came from Chile, it came from Mexico, it's organic. No, you need organic certified from this country and get things in season.
Yes.
If it's out of season, it's not American.
Yes. Wow.
And see, so that's so important. So our nutrients are missing in our food. Then the pharmaceutical industry, when tobacco was suddenly banned,
I was gonna say, let's
we had to do something to make people addicted.
yeah.
And so I won't mention the companies, but the cigarette companies
Yeah.
went to the pharmaceutical industries. Remember, they made the cigarette addicting?
Yes, they did.
Yeah. Okay. So the same pattern was made in children's cereal. and all the red dyes and the different colors right there in our children. And then another funny thing is, when did we ever hear, when we were growing up, peanut butter allergy?
Yes, I know.
Peanut allergy, tree allergy of nuts.
Exactly.
Well, what had happened is that a study came out of Europe that was adopted here, said that we can avoid a peanut allergy if the pregnant woman doesn't eat any nuts, and that the baby doesn't get any nuts until it's 3. So what happens? There's no antibodies.
Yeah, yeah, yeah.
So you don't forget, the baby, if it's breastfed or not, the immune system has not developed antibodies so that the child will not have an allergy. And then to deny the child till they're 3 to eat a nut. And so now we have EpiPen in
Yes,
school. Airplanes, nobody can have a nut.
yes,
And the people that come from other countries, especially like Africa and other countries, they South America, where did this, why tree nuts? What is it? It's because we did it.
yes,
The pharmaceutical industry, under the influence of the tobacco industry that had to unfortunately drive the market. And so this is where that peanut allergy, now that goes to food of the mother, should always, everybody needs to be organic. And so cancer is now being, there's carcinogens, things that cause cancer in food from the chemicals. Now, when you go to the store and you pick up something, look at the label. If it looks like a chemistry lab,
yeah.
Please do not. If you can't pronounce it, don't eat it.
That's smart. Very
If you can't pronounce it, don't eat. I was a chemistry major, and I look at it and I go, "Oh my God, this is tragic." And you see all the dyes and
yeah.
things and names you can't pronounce. Well, you don't buy it.
Right.
So organic, and again, certified.
Certified organic.
Yeah. And now they have found not to microwave with the plastic. You know how people go to the stores and they buy food that's plastic wrap, make a slit, put it in your microwave and take cover, all that. Well, chemicals are being released.
Of course they are.
Yeah. And now we have in perfumes for women and men, but all the foods and the products are not natural. And as a result, microwaving with
yes.
plastic. So we have forever chemicals now in our body disrupting our system.
Mm.
And therefore our immune system is overwhelmed.
On overdrive, yeah.
Yeah. And then not getting enough sleep that is the type that is restorative sleep, not lying in bed and taking a pill to sleep. Restorative sleep. Now, exercise, as you brought up before, is very important because it helps you burn some calories, not that many, but you burn calories, but it emphasizes breathing, which is important. And it also makes you more social, especially if you go with a friend on a trail, go hiking. Now, socialization, when COVID came, what happened?
Yeah.
And down, and our younger generation has suffered badly. And now there's no exercise, and they start eating, forever chemicals at home.
Forever chemicals. Listen to that, audience. Forever chemicals. Whoa,
yeah.
let that land.
Yeah, think about it, because that's what you're doing in your body.
Right.
Now, we remember from Vietnam, Agent Orange, which
Absolutely.
they denied. Roundup on our soil completely nuked our soil.
Right.
And there are no nutrients in it. Yeah. And then the poor chickens and the cattle they're not being fed, they're being fed corn.
Yeah.
Corn. What happened to grass? The grass isn't any good because now it's got Roundup in it. It's a very vicious cycle. So how do you stay healthy?
Yeah.
Well, you have to have purpose in life. You have to have a forgiveness in your heart, because we all suffer from life. But how do you handle that? So you need a shield, and the shield is called forgiveness. And forgiveness releases your body of the stress hormones that you get from anger, repressed bad feelings, and the lack of socialization. Now, of course, people do hurt us. That's life.
Yeah.
But you stay hurt and the other person doesn't.
Exactly.
The only person that's hurt is you.
Yeah. Yeah.
So all these factors of not being normal humans, the mother not breastfeeding, lack of socialization, lack of forgiveness, lack of purpose.
Well, that's it. That's a great one to start with. And I wrote it right down. Lack of purpose is so prevalent.
You know, when you wake up in the morning, and if you have no purpose for others, I'm not talking about for you to buy a Porsche.
Yeah. Yeah. Yeah.
The
Yeah.
narcissism.
Yes. Yes.
We have become, literally, if I may use the word, pagan, in the sense that it's all about me and about what I can buy. And they buy something and they need something else because they get that. But when you're doing things for others, look at these horrible hurricane disasters. The people that are volunteering to help, they're getting a stimulation of health.
They are.
When you do for others, we were not born for ourselves.
Absolutely.
We were born for others, just like a mother and father are born to have their children imitate them with good example and pass on. When I was a child, we did Girl Scouts.
Yes.
And I think that's, I don't even know if that's still there.
I think it
Except
is.
the cookies,
Yeah.
which are not healthy.
No, no, they're not.
No, so, oh, I hope I don't get in trouble with them, but I haven't seen an organic Girl Scout cookie anyway. But again, we played outside in the sun. Now I'm going to bring up vitamin D.
Okay, and I want you to talk about omega-3 fatties too.
Yes.
Okay.
Okay. Vitamin D is vitamin D3 plus vitamin K2
Yes.
work together for the bones.
Yes.
Women at a very high rate have osteoporosis.
Yes, we are.
And they're not exercising, which is a stimulant for the bone. They're not getting collagen,
Yes.
which is a factor that builds bone, collagen, but it has to be type 1 and 3.
Yes.
Don't get the one that has 10 of them or something. It has to be type 1 and 3 collagen. And you need bone broth.
Yes.
But it has to be organic. And you need exercise because stress builds strength. And that's another factor for exercise.
Indeed.
And all these things. So now we found out in breast cancer, almost all of my breast cancer patients have a low vitamin D.
Interesting.
Now, it should be, you should have your doctor take a lab test for you for vitamin D3.
Agreed.
And it should be between 40 and 80 international units.
Okay, I
The
wonder
the lab says 30 is fine, 32 is fine. No, but for breast protection, which really is probably ovary, I mean, everything, it should be between 40 and 80. Now, we children in my era had recess at school outside.
Sure.
Winter included.
Yes.
Our windows were not coated and they rattled, but the sun came in.
Yeah.
But we played after school all year long outside, and we're getting natural vitamin D. 15 minutes of the sun on plain skin, not sunblock, makes vitamin D, but that's gone because everybody's indoors.
Yeah.
And then the sunblock, I know there's about skin cancer, but I'm talking about not being in natural sun, which we were. That's why we're so healthy. In
Absolutely.
my age group is still going because we after school, in school, after school, and we girls did double Dutch.
Yes, double Dutch.
Yes, that's means skipping rope for those that don't know what double Dutch is.
Thank you. Thank you.
And we played all kinds of games and sports outside. We played jacks, hip hop, hipscotch on the sidewalks.
Uh-huh.
But we were outside, outside, outside. And then dinner time came. Our fathers were there. The meal was ready, and you had to be there. That was therapy. That was socialization. That's where things got discussed. And the famous saying by your mother was, "Wait till your father comes home."
Yeah, of course. Yes, again.
So we had a strange discipline that way.
Yes, exactly.
But
Well, you're nervous the whole time, of course. And then,
yeah, and your father didn't do anything. He just gave you that look.
yeah, exactly.
Like, how did you fail the family?
Yeah.
The family was important. Family, relatives, neighbors. We were really neighbors.
Oh, yeah.
I
Absolutely.
never had a key to my house.
No, it was not.
No one had. We
No.
had keys in the car,
Yes,
in the ignition.
exactly.
When we went away, the neighbors came into our house with the newspaper in the mail
Exactly.
because
Exactly.
they were really our neighbors.
Yeah, yeah,
But
yeah.
that's socialization.
It is. It is.
We
And I
didn't
think
have,
we can do this one family at a time, right? And the
yeah.
kind of intervention that you engage with your patients is so holistic that it brings about many facets of better health.
Now, what's happening with these forever chemicals in our children's food,
Let's talk about it.
our young people, boys and girls, are getting puberty early.
Uh,
Breast cancer increases if you have for the girl, her first period before 12.
12.
They're
Yeah.
now getting it at 9, 10, 11. And why? Forever chemicals, lack of exercise. I mean, it's just puberty before they're even ready emotionally.
Oh, exactly.
And you see, it's affecting. So we know that early, for the girl, early menarche, we would call it, your first period. We know that if you have menopause 55 and older, that's a long term of hormone to the breast. If you have your first baby at 30 or later, that's again not the it's high risk. If you don't breastfeed your baby,
Yeah. Right.
another high risk. These are very simple things that we used to do.
They are simple.
Yeah.
Yeah.
And we have lost by losing your sense of purpose and turning it in on you, what's in it for me, ruins your immune system because you're looking inward and you don't see your neighbor. And nowadays, people joke, "I don't know my neighbor. They've lived next door for 5 years. I don't know. I never said hello," or they waved.
Exactly.
Yeah, but there's no more bridge.
Yeah.
Family parties, neighborhood parties, block parties.
Right. Right.
So again, cancer has always existed, but I just read a study that Asian women and islander women, like Hawaii islander,
Yes.
their rate of cancer of the breast has increased to 51%. And no one's understanding why, but I think they're adopting our forever chemical food,
Yes.
our lifestyle, delaying pregnancy.
Yes.
So the benefits of nature are being thrown away.
They are.
For the wrong reason.
Yeah. Yeah.
And it's sad to see the society so sick. I never saw so much mental illness
No, this is it. This is it.
Yeah. When did you ever hear when we were growing up, children committing suicide? And I'm not talking about fentanyl. I'm talking about suicidal ideation in
Exactly.
children.
Exactly.
And I'm not talking about those poor souls that are born with a spectrum problem.
Absolutely.
I'm talking about a healthy baby
Mhm.
with not any kind of history.
Mhm.
When did we ever hear of children committing suicide? Now, the foods that they're eating,
Yeah.
that they're being addicted to, is altering the brain function. Now, I'm going to jump a little bit further to older people
Okay.
who are getting Alzheimer's. And now it's found out to be type 3 diabetes.
Oh, this is this is amazing research. And talk to us about that, because like my mom was diabetic and now we're all
All
concerned.
right, now saying a diabetic.
Yes.
A diabetic has 28% increase of breast cancer. 28% increase of breast cancer. Obesity.
I'm gonna go there, but it's a sensitive topic, and let's talk about it.
Obesity is from the forever chemical foods, lack of exercise, lack of socialization, lack of purpose. And what do we use? They use food as a drug.
They do, and our breasts
That
get
they're
bigger
getting,
first.
right? But the food they're getting is a forever chemical, and they're taking to alcohol. So 1 drink or more for a woman, 2 drinks or more for a man. So don't forget, men get prostate cancer.
Yes, of course. Yes.
And so look at their lifestyles. So it's so simplistic that it's not paid attention to.
Right. Now,
So everybody's worrying about, I want something to cure cancer. Well, why do we have to have cancer?
well, there you have it. There you have it. Because most
Why
people
don't we
feel
work as a nation to be having health? Health should be a priority in our country to get rid of the damage done by the pharmaceutical industry, which is greed.
yes.
Yes, we need a pharmaceutical company, but we don't need to poison our people.
No, we didn't.
And people buy into it. And this is very disturbing. Now, people nowadays are in the bed watching TV in their bedroom.
Yeah.
And that blue light. It's
Yeah.
another problem.
That is a big problem.
And how do you get restorative sleep in a room with lights? They fall asleep with the TV. This interferes with restorative sleep. And that affects your immune system. So all these factors are simple, but when you look at the spectrum, they've been created and the cancer rate has gone up. Everybody wants a cure, but we could do something called healthy living with prevention.
Completely.
Now, I do want to address those women that have been diagnosed with breast cancer.
Thank you.
Fortunately, because of screening mammograms, ultrasounds, MRIs, monthly breast self-exam if taught well, lifestyle changes, we can pick up, most breast cancers can be picked up in a curable stage. Actually, breast cancer is the most common cancer for women. It's also the most curable cancer if annual mammogram, ultrasound, physical exam, nutrition, all the lifestyle things. What's your vitamin D level? What's your forgiveness level?
Yeah.
Yeah, I mean, all this matters because it interferes.
I want our listeners to just hearken back to that. Have this land with you. Breast cancer is so preventable
And curable.
And curable if we do
Mhm.
these things that the wise doctor has outlined. And yet, if we fail to do that, boy, oh boy. So the next steps, the step by step, the women that have been recently diagnosed, and then also I have very dense breasts, so
That's a risk.
before
That's
I
right.
came to Montclair, I had never gotten a 3D. I think it was you that recommended 100
Yes,
years ago. Go get a 3D. So let's talk about.
yes, yes. But the curability in people who do have breast cancer, I want them to know I don't want them to be survivors.
Thank you. And your word instead is,
Thriver.
there we have it.
Because if you want to be a thriver, you will incorporate healthy living. If you want to be a survivor, it always reminds me of when I was a child, the cat would catch a mouse and bring it to the back door. And the little mouse would try to get away, and it did. And that was the survivor mouse. I don't like survivor syndrome.
Yeah, exactly.
Yeah, I like thriver. And one of my patients went on, it's over 20 some odd years, she started for women, thrivers. And because I tell my patient, I don't want you to be a survivor. And they look at me and I
Yeah,
say, oh, I want you to be a thriver.
yeah, yeah. All right, so tell us
So
about a couple of
there's
survivors.
no reason to be negative.
Yes.
With all of the, now we're using immunotherapy, and now we're starting to use, this is the clinical trials, starting to use the actual cells of the patient as a vaccine.
Ooh.
See, so this is all in research,
Yes.
but if we can get the cells and send them to the lab and then re-inject them into the patient for natural immunity.
Yes.
See, so immune therapy, very important. Now, I'm going to jump to another subject because we're women and we like our hair.
Yes, we do.
Now, so many women are devastated with understanding about hair loss if they're getting treatments. But we now have, and we really did have, but now it's back again, cooling caps.
Cooling caps, yes.
Yes. When I started, I was trained by wonderful breast oncologists in my training, and we had cooling caps. And my patients, didn't really lose their, it may have thinned, but they didn't lose it. So cooling caps are there. I mean, for those who are ongoing treatment. Music is so therapeutic for the brain.
Yes.
The brain needs a completely healthy environment for your immune system. Now, our intestine is critical. It's called gut health.
Yes, indeed.
And our gut health affects our brain.
It does.
Now, we have a rise in diabetes. We have a rise in insulin resistance. We have a rise in obesity. Now, obesity is white fat, which is estrogen.
Yes, indeed.
And so a sense of discipline in what you're eating, which is very simple. It's cheaper than going to a doctor.
Yeah.
What you eat, how you eat, microwaving plastic, drinking out of plastic bottles. Now there are some companies, I don't want to go into names, but there are some companies that have BPA safe plastic, but
Yeah.
most of these, don't buy things in plastics if you can.
Exactly.
Glass, good old fashioned glass. Women who cook, don't get the Teflon and the non-stick. Go back to the old fashioned griddle that we had in the old fashioned frying pan.
Yeah. Cast iron skillet.
It's so important because you're not going to get a forever chemical.
Right. Right.
Now, the other thing that's very popular is to barbecue.
Yes.
So charring your food.
I was going to ask you about that. It's like carcinogens.
Is a carcinogen. Burning your food, barbecue. Everybody talks about barbecue. You make a healthy, you can have an organic chicken and you burn it to death in the barbecue. And so then they said, oh, isn't this good crispy chicken? Yeah, from a barbecue. So you've got a toxin.
Okay, so I gotta interject here. I love seared steak. and I just got an air fryer, and I like to put in chicken because I'm on, Atkins, and so fat is okay. As I put in chicken thighs with the skin on it, and I do it air fryer. Is that making the skin crispy because it's air? Is that a carcinogen?
I don't have research to answer that.
Okay, I'm hoping not, but I wanted to throw
Yeah,
it out.
I haven't gone into air fryers yet, but I do know that the summer especially, everybody says we barbecue everything.
Right now. Right now.
And that has been known to be a carcinogen from the heat.
Exactly. Well, we have a couple about 9 minutes left, and I invite any of our audience to chime in with questions on the Facebook page there. I want to circle back, like Dr. Santoro kind of said, well, yeah, and I'll be, what did you say? You were born on the
18th of October,
18th,
Feast of
the
St. Luke.
patron of Doctor's Day.
Yes.
And so she said she was meant to come in here, and she was. And she is, as I said, 86, nearly 86 years wise. This woman is the epitome of looking at how a vulnerable group of people, women, who have been plagued with this breast cancer and the psychological aspects within themselves and their families. Big impact. And she's out here telling us it's largely, in many cases, preventable. And I want us to take heed to that. So let's talk about free radicals. Do you get too much involved with free radicals? I kind of was up on them a little bit 6 years ago. It seems to not be a good thing, obviously.
Yeah, well, it's the entire environment that we're talking about.
Fair enough.
People don't realize that if you took your airplane flight to Italy
Yes.
from New York,
Of course you would.
it's radiation. But they don't want to get a mammogram because they're afraid of radiation.
Oh, talk to us about that, the whole levels of it. Yes, thank you.
Yeah. So outdoors, just walking out the door, you're getting radiation. So the radiation from a 3D mammogram is equal to 2 months outside. So you see how it's been.
Yeah.
The poor people have been brainwashed. Oh, get a thermogram. Well, a thermogram is not standard of care.
Thank you.
It is misleading. It just shows inflammation, and you can have inflammation from mastitis, from anything. You've been bruised or whatever, but it doesn't pinpoint. And if the time it finds a cancer, it's big. Where here we can find precancer, stage 0 cancer. These are cells that have not gotten out on a 3D mammogram. And if it's dense, you need an ultrasound, and ideally, I call it the trifecta, on my MRI.
MRI, ultrasound, and a 3D mammogram. Everybody got
now
that?
You can just get in a dense breast a mammogram and then go to an MRI. Now, sometimes when they see something on the mammogram, they'll get an ultrasound right away.
Okay.
But high-risk patients really should be getting MRIs. That's a 98% answer. But now you need a mammogram for something called microcalcifications.
Okay.
That cannot be seen on an ultrasound or an MRI. And that can be the precancer stage or stage 0, called ductal cancer in situ, meaning it stayed in the duct. Ductal cause in situ, in place, in the duct. Now, invasive cancer is the lump one.
Okay. Okay.
Now, sometimes it can break out of the duct just starting, and we pick it up early. So breast cancer is the most common cancer in women. It's also the most curable. Now, the other thing I'm concerned about is that doctors not realizing it. Say you don't need a mammogram, you're 70. Well, the highest risk of breast cancer, 1 out of 8, is at age 85.
Is that right?
And I'm operating on people in their 90s. It's just a little lumpectomy because they did their mammogram. So I think it's not driven by science. I think there are other factors that don't want to pay bills for,
Parents don't want to pay bills. Oh, sorry.
yeah. So I would say, as long as you're healthy, I mean, if you have Alzheimer's, there's no need to go there. If you have heart failure, I mean, I'm talking about the minor ailments that people are functioning. They should continue to get their mammogram. Now, another problem is that some women, the doctor says, oh, you finished your treatment, goodbye. You should stay following up for the rest of your life.
Exactly.
Now, those women that have that gene BRCA1 and BRCA2,
Yes.
if they choose, it's a choice, to get a double mastectomy, their risk 15 years later is 1% of recurrence.
15 years later.
1% chance of recurrence. So that's why genetic testing, and it has to be 23 genes, not the 23andMe, please.
Okay.
That's not, don't do that.
Yeah.
There's a company called Invitae, there's different ones, but it should be 23 genes.
Okay.
That, and then there's syndromes, one's called Lynch syndrome, where there's different kinds of cancer, lots of different kinds of cancer in a family.
Okay.
Dr. Lynch, I knew him when I was younger, and he was more mature, but he took years for them to believe him, as always.
Yeah.
But please get, if there's family history, especially if in your family it's premenopausal, mother, sister, daughter. Premenopausal is a clue that there may be a gene. Now, women, I know this is Rosh Hashanah, but women who are of Ashkenazi descent have a 10% chance of having breast cancer risk. And so they really should be tested, because they could carry the BRCA1 and BRCA2 gene. And then if they do have it, they can save their life by a prophylactic bilateral, mastectomy. And again, 15 years later, we find the recurrence rate may be 1%. But you have to have lifestyle too. I mean, it's not just.
Absolutely.
Now, let me talk about reconstruction.
Okay.
I was the only woman at the time at these breast meetings. And I was working with plastic surgeon, and we were keeping up about reconstruction when it first came out. And we were finding that women who had like a prophylactic procedure, we could do reconstruction. They were making us wait 2 years. And then they found out there was a woman plastic surgeon, she did a paper, and I'm forgetting her name. I think she was at Columbia in New York, found out there's no difference if you can do it right away. Now, there was a very famous breast surgeon, no name. I was at the meeting and I said, we are doing immediate reconstruction. We started with something called a tissue expander at that time. And I never saw a gentleman surgeon get so red in the face. And he said, you're supposed to wait 5 years. There's no science on that. No science. Now we can actually talking about the beauty of reconstruction, so you don't have to go quote unquote flat.
Yes.
We've gone from tissue expander to implant.
Yes. To
using your abdomen tissue. It's called a deep flap. Move that up, and it's done microscopically to connect to the internal vessels. And it's called a deep, so it's natural. It's all you. And now, if someone has lymph node dissection so they don't get a swollen arm, our plastic surgeons trained microscopically can anastomose, put together lymph to vessels so the person doesn't get a swollen arm. You see how far we've come.
How far? And
So
yet,
lymphedema should not be. Also, we're doing lumpectomies
yes.
so much. Our radiation has changed to it's called IMRT and partial radiation, all different fractions, individualized to the patient. So anyone out there listening, if you have a breast family history, you should be found by a breast center. And if you do have cancer, you have to make sure that you're at a place that you can get enrolled in a clinical trial with your medical oncologist. There has to be a team of geneticists, psychologists, the breast surgeon,
Okay.
the radiation oncologist, the social worker,
Mm.
because we're a person, and also nutrition.
Takes a village, it takes a team, and it takes that leadership, that pioneering curiosity and follow through of women like Dr. Elissa Santoro. And she is one in, she's like completely up there in terms of national recognition. If you live anywhere close to the tri-state area, I personally am pitching, and she didn't ask me to do this, but the Montclair Breast Center in Montclair, New Jersey, where Dr. Elissa Santoro still practices. And I want to thank you from the bottom of my heart. This has been so rich with information and mostly hope. Let's gather our wits about us, become completely conscious about our health and that which can prevent breast cancer, because you heard it from the doctor's mouth. It is one of the most curable cancers in women if we take these precautions. And there's no better time than today to start. Dr. Elissa Santoro, our hearts are very, very grateful. Our bodies, our breasts, our entire, the health of the women's bodies and their families are forever indebted to you and your perseverance, especially early on with that legislation, because we don't have so many studies on women. I thank you. Wow, how was that generations and decades before it became vogue? Get into a clinical trial, women, and become a thriver. Thank you very much, Doctor.
Oh, thank you for letting me share my joy
It
to make women whole again.
well, there's a tagline for us to all go home with. Make women whole again. It's a participatory exercise, women. Let's just look inside and say, I'm worth it. Let's find that purpose and let's pursue it and be thrivers in the process, with or without cancer. Thank
Amen.
you so much.
Okay.
All right. Good night.
God bless. Bye bye.
God bless you too, Doctor.